I am wondering which symptoms doctors simply do not believe you have, hint that you are overreacting, or suggest it is only anxiety when the symptoms are very physical, or even directly say you made it up. Which conditions are called trendy for men to have, implying that you just found it on social media or otherwise made it up, no matter how severe the symptoms. Do you have experiences like this? I am genuinely very curious to hear. I am well aware of the common ones for women and realize I do not know any trendy, yet very real ones for men. So I hope you can enlighten me on that. Thank you. Story 1. I personally know two people who, for months, went to doctors for fatigue and were given various unhelpful explanations such as stress, diet, sleep, and vitamin D deficiency. Eventually, they were diagnosed with lymphoma after a doctor took the time to thoroughly examine them. Story 2. While I know this is more common for women to experience than men, it is something that needs to be addressed. That is normal. Depression, weight gain, sexual side effects, anxiety, sleeplessness, you name it. Going to the doctor to address an issue that can be traced to a possible external cause like medication or aging, particularly perimenopause in women. Far too many doctors, rather than address or treat the issue, simply respond, "That is normal." I did not ask if it was normal. I told you I do not like it and I want it addressed. Story 3. I am in my mid-30s. I had my first appointment for testicular pain at age 14. The area gets inflamed and sore quite often. It also doesn't feel right, like the tissue is damaged. About 2 years ago, I finally got someone to say, "Yes, you have a varicocele, which is likely the cause." I went back to the urologist. He said he wasn't concerned and wouldn't perform any operation to fix it. He shook my hand and apologized. I have been to my general practitioner many times about this. I also have pain in my scapula, spine, and sacroiliac joint. I have had multiple x-rays, physiotherapy, and 2 magnetic resonance imaging scans, but they say nothing is wrong. I asked for a referral to a rheumatologist. They declined, saying they were not concerned. I had a sudden onset of extreme pain, and it has hurt ever since. This should be taken seriously. I cannot afford private health care or even a consultation. I feel like this is it now. My condition will get worse, and there is nothing I can do about it. Story 4. As there is no flare, I hope it is okay for me to answer as a woman. My last boyfriend had drug abuse issues in his youth while his mother was dying of cancer. He had been clean for 17 years, but when he went to the doctors with strange pains and symptoms, they kept accusing him of drug seeking and refused to take blood or perform tests. He was labeled as a drug addict in their system, despite being clean much longer than he had been using drugs, so they assumed he was just looking for drugs and wasting their time. He died at age 40 of cancer. Story 5. I had a doctor decide that because I was a college-age male with long hair, I smoked a lot of marijuana and blamed a medical issue on it. The doctor refused to treat the actual cause. I do not think I had ever even seen a joint at that point and barely drank alcohol. Story 6. When I thought I had a heart condition, my doctor told me my heart was damaged and I should never consume caffeine if I wanted to make it to my 30s. I went to a cardiologist. Nothing was found. I just had some temporary palpitations after the coronavirus disease vaccine, which is a known and benign side effect. Story 7. I had a Veterans Affairs doctor who completely dismissed my symptoms and told me that's not what I was feeling. He referenced an X-ray from 2018 and just prescribed 800 milligrams of Motrin along with various creams for my low back pain. I decided to see a different doctor. The first thing she did was order a magnetic resonance imaging scan. Then she told me to stop taking Motrin, as it did nothing for the pain I was experiencing. She gave me a real painkiller. She then referred me to a spinal specialist. The magnetic resonance imaging scan showed major nerve damage, and they began to treat me correctly. I went back to that Veterans Affairs doctor and got the same response. I pulled out my phone with the magnetic resonance imaging scan and the specialist's notes. I told him he was not doing his job and that he needed to take different action because he does not care about his patients. I then went to the Human Resources Department and filed a grievance against him. Story 8. I was suicidal as a teenager. I gathered the courage to go to my doctor, and she told me that I was grown up now and had to be strong. Story 9. I had to see multiple doctors and go through many challenges before anyone would believe my back pain was real and not a way to get painkillers. I assume it is because I am a rough-looking 6'3" man with tattoos, a beard, and long hair, but I am actually a very successful professional in the outdoor industry. Story 10. Anything stress-related. Also, if they can possibly tell you just lose weight, they will. It is not just women who get that advice. Story 11. I had severe nighttime anxiety that gradually went away after waking up. I was so tense that I tore a pectoral muscle while sleeping and went to the emergency room with extreme chest pain. It was largely dismissed as regular anxiety in an unusual patient. It turned out to be sleep apnea. Suffocation releases fight or flight hormones, and I was experiencing this response 3 to 4 times every minute. Story 12. Women seem to believe that doctors do not take them seriously because they are women, and that doctors treat men with concern and respect. As a man, I have rarely been treated with respect or taken seriously by a doctor. They do not listen. They dismiss me. They tell me that it is all in my head. They just try to get me out the door as fast as possible. For example, I had to see 12 different doctors to get my ulcers diagnosed. I had 6 bleeding ulcers and was told that I was a hypochondriac and should stop bothering doctors with my delusional concerns. I could have easily died from those ulcers, and 11 doctors told me I was crazy. I am a man. It is not because you are a woman. It is because some doctors are dismissive to everyone. Story 13. They really do not care if you feel bad, have no energy, and are stressed out. Ask to have your testosterone levels checked and you get a blank stare. Story 14. Turns out dissociating and picking your eyebrows, hair, eyelashes, fingernails, toenails, and so on is not normal. I have just always done this way and thought zoning out while driving was normal. Story 15. I get very mentally fatigued in the early afternoon to the point that some days it is difficult for me to concentrate until it passes, usually after an hour or two. Doctors have told me for years that it is normal and there is nothing wrong. Unless it is part of getting older in my 40s, it does not feel normal to me and was not present in my 20s or early 30s. Story 16. Mental health. Being advised to exercise and get more sleep while on the verge of a mental breakdown. Story 17. I have had an intermittent cough for 3 to 4 weeks. The doctor is addressing it by analyzing a sputum sample. Story 18. Having had male doctors for most of my life with symptoms that never improved because they were ignored and caused to worsen, I changed to all female doctors. They actually listened and understood that my symptoms and conditions were more than just depression and anxiety. More importantly, as I was a nightly drinker using alcohol as a form of self-medication, the male doctors wouldn't consider it beyond poor lifestyle choices, even though it was causing my liver enzymes to go off the charts. Luckily, I know my body well and have a strong mind-body connection that compensates for what is disconnected. I sought a second opinion from a new female doctor who did blood work on the first visit and found I had a liver infection causing all my symptoms and general unease. She has also helped me discover more about myself by listening over the last 7 years. I refuse to change doctors and will stay with her as long as I can. Most of the other specialists I have seen have been female and the best ever. Story 19. Body mass index defines me as obese. I do strongman training, and I do not actually have that much fat on my body, just a few years of muscle from lifting heavy rocks frequently. Explaining this to doctors over the phone is complicated. Story 20. Mental health, body dysphoria, pain, chronic pain, and related issues. I have been diagnosed with psoriasis for decades, and still nobody will treat it. I know I do not have to be pretty, but this condition is driving me completely insane. Story 21. A lot of medical thought is conventional and often incorrect. For men in particular, the biggest areas of misunderstanding relate to pain and sports injuries. For example, I knew a younger man at work who was injured while playing hockey. He visited multiple doctors about his back pain, but they were very unsympathetic. One doctor even accused him of faking his back pain as a strategy to get prescribed opioids and asked him to leave the office. I advised him to get an MRI of his spine immediately. He did, and it was discovered that he had a severely dislocated disc that required surgery. Story 22. Men get dismissed about needing testosterone replacement therapy. They are told that a testosterone level of 300 nanograms per deciliter is perfectly normal. The symptoms are not taken seriously. Low energy, low libido, weight gain, muscle loss. At 275 nanograms per deciliter, I was unable to produce semen. All of these symptoms lead to body dysphoria and low self-esteem, yet men are expected to simply live with it. The effect on their mental health is also not taken seriously. There is a significant disparity in how the mental health aspect is addressed. A transgender man goes to the doctor because of body dysphoria, and it is deemed critical to the patient's mental health to ensure this biological female, who has no biological need for testosterone, receives testosterone therapy so they can feel more like a man. It is considered a matter of life and death to provide access to testosterone to make their body more muscular, hairier, and more masculine. But when men feel the same way because their testosterone has dropped to insufficient levels, no concern is given to the impact on their mental health and self-esteem. For a man to seek testosterone solely to make his body more muscular, hairier, or masculine would be unacceptable. Yet that is precisely the reason hormone therapy is given to transgender men. It is very hard for a man to get testosterone, and once on it, it is very hard to keep it. The gatekeepers have very strict guidelines, and if the patient's blood work goes even slightly out of range, the therapy is terminated, even though it is expected that blood work will fluctuate. A hematocrit level of 51.7% is enough in some cases to terminate therapy, even though hematocrit varies widely day to day. It is not even clear whether a hematocrit between 51 and 54% is clinically significant, but if your hematocrit falls in that arbitrary range, you will be denied testosterone replacement therapy. Story 23. Circumcision trauma and regret are serious issues. It is frustrating that something so important is often trivialized, even though it would be taken very seriously if it involved another body part or if I were female. Story 24. Most of the issues I have ever had, the first 1 to 3 doctors I dealt with were useless and either failed to diagnose the problem or barely even tried. It feels like if they cannot diagnose it in 5 seconds and preferably prescribe medication, they do not want to deal with it because they want to move on to the next patient or are completely incompetent. It is very frustrating to deal with an issue for months, waiting to see a specialist or primary care doctor, and they either gaslight you, refuse to do anything about it, or cannot even diagnose the problem in the first place. Then you have to find a new doctor who might actually try. My old primary care doctor, who actually knew what she was doing, got so sick of referring patients to specialists when the specialists failed to help them entirely or just ran some tests she could have performed herself. Story 25. Went untreated for severe sleep apnea for more than a decade because the doctor thought I needed to go to bed earlier. He was away and I saw a younger doctor. To my surprise, the night terrors, sleepwalking, sleep talking, and significant fatigue were actually symptoms of a life-threatening disorder. I stopped taking half a dozen medications when that was treated. Story 26. Some doctors are not competent nowadays. That is why you should use all available resources to research and visit the doctor prepared. Some doctors merely follow procedures without genuine care. Story 27. Low testosterone. I went to my doctor as a 40-year-old man who has been working shift work for 20 years. I told my doctor I was having trouble sleeping and asked for a full blood panel to check vitamins and hormones. His response was to write me a prescription for a sleeping pill. I declined the sleeping pill because I had used them in the past and did not like the way they made me feel. He then said it sounded like I was depressed and prescribed an antidepressant. I explained that I was not depressed, just not sleeping well. He responded that it sounded like I have attention deficit hyperactivity disorder and prescribed medication for attention deficit hyperactivity disorder, which has insomnia as its most common side effect. He advised me to take the stimulant in the morning and a sleeping pill at night. I left the office with 3 prescriptions. I never filled any of them. Instead, I went to a private hormone clinic in Canada, paid out of pocket for a full blood panel, and found out I had a couple of minor vitamin deficiencies as well as the testosterone level of an 80-year-old. I was prescribed testosterone replacement therapy. 6 months later, I was sleeping like I had not in years, had more energy than I had in years, and was feeling better than ever. Story 28. I have asked my primary care provider for anxiety medication or referral to a psychiatrist for almost 2 years. He keeps telling me that stress and situational anxiety from work are not the same as generalized anxiety disorder and should not be treated with medication. When I tell him I have trouble eating and sometimes trouble sleeping, he tells me to take a couple of days off work and that it will get better. There is no actual acknowledgement that I am crawling out of my skin and nauseous most of the time. Story 29. Men do not experience this as much as women because men do not visit doctors as often as women. It is not doctors intentionally misleading their patients. Rather, it is doctors who are not proficient in their jobs. If they cannot find a physical explanation for a symptom, they will make a guess about what it might be. Story 30. I was having frequent sore throats a few times a month with a mild headache. The doctor blamed stress and told me to get a new, easier job if I wanted to improve. He happened to be familiar with my workplace and knew it was very high stress. He was completely wrong. The sore throats were actually canker sores caused by a combination of reflux, chronic hyperventilation, and trigger foods like chips that cut the inside of the mouth, spicy foods, and dehydrating beverages such as coffee and alcohol. I cut out coffee and alcohol, and my reflux is completely gone. It had gotten so bad that I could never lie on my right side and had to sit bolt upright in the middle of the night due to reflux causing vomiting. I also had trouble swallowing at times, apparently due to scar tissue buildup from the acid coming up. I cut out spicy and acidic foods and other common canker sore triggers too, and now I almost never get canker sores. When I do, I have a couple of treatments that make them go away within a day or two. It is never so bad that I feel feverish or have headaches these days. I can almost always pinpoint exactly what triggered it. The chronic hyperventilation is still something I am struggling with. But considering my life-changing symptoms are entirely cured, it is more of a minor annoyance. I still have and love my job. Story 31. Just lose weight. I know women hear that a lot too. I once went to the emergency room with a kitchen knife sticking out of my foot, and the first doctor who came and looked at me said that I was probably having trouble walking because of being overweight. I am still pretty sure it was the knife causing the problem. Story 32. I see men who go to the doctor. The doctor gives great advice, provides a referral, or prescribes medication to help with their issue, but the men complain that doctors are too quick to diagnose and prescribe something. I feel bad for doctors because of this. Story 33. For me, it was an enlarged prostate that was aggravated by hemorrhoid surgery. I had problems urinating after the surgery and needed a Foley catheter. During the postoperative follow-up, I still felt pressure and had some issues with urination, but they would not refill the medication. I called my doctor, and he told me to have my prostate checked at the next postoperative appointment. The nurse practitioner refused and told me I was too young to have prostate issues. She refused a medication refill, accused me of drug-seeking behavior, and was very rude to me. Finally, I was able to see my general practitioner. He performed the exam, confirmed the enlarged prostate, and refilled the medication. My urination problems went away. Story 34. Low testosterone due to aging. There are many benefits to giving testosterone to older men, yet it is very difficult to have it prescribed. Story 35. We would not know because we do not go to the doctors no matter how bad it is. Fellow men, go get it checked out. Story 36. A few years ago, I mentioned to my primary care physician that my wife had been saying my hearing was poor. He asked how long I had been married, and when I said 7 years, he chuckled and said, "Sounds about right." He ended up leaving for a different practice, so I had to find a new primary care physician. I mentioned the hearing issue to her, and I was sent to an audiologist. Sure enough, I have moderate hearing loss. In general, I would not say I have been deceived by doctors. I have been fortunate not to need much medical care in my life, but when I have needed it, I have almost always been taken seriously and treated with respect. It probably helps that I am not one of those people who constantly wants antibiotics for a cold or who blames all the symptoms of a poor lifestyle on low testosterone. Story 37. Tingling, cold sensation, and numbness in my right hand. I experienced these symptoms for about 6 months, and fine motor skills were severely affected. I finally got an appointment with a neurologist. They told me it was all in my head. A couple of months later, the symptoms tended to fade, but they never completely went away. Story 38. I experienced discomfort in the testicular area. I asked my doctor for help, and she told me to manage it myself. I am frustrated with the medical system failing me at every turn. Story 39. I have a lump in my left breast that sometimes hurts. It is uneven and really hard but moves. Nobody I know seems to have the same issue, and what I could find online was inconclusive. Doctors did not seem to know what it was and sent a referral to get it scanned, but it was immediately discarded, and I never heard anything. The doctor did not give up and sent me for a scan every year I came in for something else. I told them I still had not heard anything. After 5 years, I assumed it was obviously not cancer or I would be dead by now. Finally, I got a scan and I think it was an oncologist. The doctor berated me as if I were a total idiot for getting this checked out and accused me of using steroids when my body obviously was not muscular. Nobody told me this was normal. Nobody told my doctor either. Turns out nobody told anyone I knew. How was I supposed to know that? Story 40. I was in the hospital for 5 weeks due to a congenital defect I did not know I had. They discussed end-of-life care with me, and now I am just normal again. I still have the defect, and it will still cause problems, but at least I have medication. They also found cancer while I was there. I have gained back about 30 pounds of muscle since then. While I was there, I told them I could not sleep. I have a habit of only being able to sleep on my right side, and my right shoulder feels like someone is driving a railroad spike through it if I sleep incorrectly on that side. My range of motion without pain had gotten worse and worse. I asked them to check it while I was there. They gave me tramadol instead of examining me or treating the symptoms, but that did nothing, so I stopped taking it in the hospital. My primary care provider decided that the trazodone originally prescribed for me was unnecessary. Before, I was taking my prescription medications at 10:30 p.m. and falling asleep before midnight. Now I am lucky if I get 2 hours of sleep a night. I basically have to stay awake until I completely pass out from exhaustion. I just want to treat the issue. Story 41. I don't know about medical professionals, but I have noticed that, especially in the last 10 years, people online often dismiss or undermine individuals who are quirky or somewhat unusual by labeling them as closeted homosexual or neurodivergent, or using other inappropriate terms. I have not seen medical professionals behave in this way. Story 42. Gaslighting implies conscious, malicious action. I think doctors are just less competent and more egotistical than we are led to believe. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.